Picture two different men, both in their late 60s. The first notices he's holding the newspaper a little further away than he used to and squinting a bit more at the fine print. The second wakes up one morning with sudden blurry vision in one eye and a headache behind it that won't quit. Both are vision changes. Only one of them needs a phone call today. That distinction, ordinary versus urgent, is exactly what almost nobody explains clearly for vision and hearing, even though both change for nearly every man at this stage of life. So let's walk through what's genuinely just aging in your eyes and ears, what deserves a proper appointment, and why staying on top of both matters for more of your life than you'd guess. Let's start with your eyes. A few changes are so common after 60 that they're basically universal rather than exceptional. Needing your arm to get longer to read fine print, medically called presbyopia, is one of the most predictable changes there is, caused by the lens inside your eye gradually losing flexibility. Reading glasses or bifocals handle this completely for the overwhelming majority of men, and it's genuinely one of the most fixable things on this whole list. Needing more light to read comfortably, having a bit more trouble adjusting between bright and dim settings, and being somewhat more bothered by glare from headlights or sunlight are all common, gradual shifts too, generally showing up over years rather than announcing themselves suddenly. None of these mean something is wrong. They're the predictable, well-understood mechanics of an aging eye, and they're worth mentioning at your regular exam, but they're not, on their own, a reason for alarm. Dry eyes are another common, ordinary nuisance worth a quick mention, since tear production naturally decreases somewhat with age, leaving eyes feeling gritty or irritated, particularly by evening or after screen time. Over-the-counter lubricating drops handle this for most men perfectly well, and it's a genuinely minor entry on this whole list, mentioned mainly so you don't mistake ordinary dryness for something more serious. Now, three specific conditions become considerably more common after 60, and knowing their basic signs is genuinely useful, since two of them can cause permanent damage if caught late. Cataracts involve the lens of your eye gradually clouding over, typically showing up as blurry or hazy vision that worsens slowly, more trouble with glare, particularly at night, and colors looking a bit more washed out than they used to. The genuinely reassuring part here is that cataracts are highly treatable. A well-established surgery restores clear vision for the vast majority of men. So this one is more of a when-it's-time conversation with your eye doctor than something to fear. Glaucoma is different, and it's the one where timing really matters. It involves gradual damage to your optic nerve, often tied to pressure inside the eye. And here's the part that makes it sneaky. The common, chronic form typically has no symptoms at all in its early stages, quietly stealing your peripheral vision from the outside in, before you'd ever notice on your own. This is precisely why regular eye exams matter more than how your vision feels day to day, since a proper exam can catch this well before you would. There's also a rarer, sudden form of glaucoma that is a genuine emergency, showing up as severe eye pain, headache, blurred vision, and sometimes halos around lights. And that combination needs care the same day, not a routine appointment next month. Age-related macular degeneration affects your central vision specifically, the part you use for reading and recognizing faces, often showing up as straight lines appearing wavy or a blurry or blank spot right in the middle of your view. Like glaucoma, catching it early genuinely matters, since treatment can slow its progression considerably, but there's less that can be done once it's advanced. The practical takeaway across all three: this is exactly why the recommendation for men over 60 is a comprehensive dilated eye exam every 1 to 2 years, not just an occasional check when your glasses prescription feels off. Two of these three conditions can be quietly progressing with essentially no symptoms you'd notice on your own, and the exam is what catches them while there's still real ground to protect. Now let's turn to your ears, because the pattern here rhymes with what we just covered on the eyes: common, gradual, and genuinely manageable, alongside a couple of things worth knowing. Age-related hearing loss has an actual medical name, presbycusis, and it affects roughly 2 out of 3 older adults to some degree, becoming noticeable for a lot of men right around this stage of life. It typically affects both ears evenly and progresses slowly. And here's the specific pattern worth knowing. It usually hits higher-pitched sounds first, which is why consonant sounds like S, F, and TH often blur together before anything else does, and why following conversation in a noisy restaurant becomes noticeably harder well before quiet one-on-one conversation does. If that pattern sounds familiar, straining in group settings, turning the television up, asking people to repeat themselves more than you used to, that's the classic, common shape of ordinary age-related hearing change. Most hearing loss after 60 is this gradual, ordinary kind, and it's genuinely one of the more treatable things covered on this whole channel. Modern hearing aids are remarkably different from what you might picture: smaller, more effective, and far less conspicuous than the devices of decades past. A few patterns are worth flagging specifically, though. Hearing loss that comes on suddenly, over hours or a couple of days, particularly in just one ear, is considered a genuine urgent situation in medicine, worth same-day attention rather than waiting to see if it improves on its own, since early treatment meaningfully affects the outcome. Hearing loss paired with dizziness, ringing that's new and persistent, or pain is also worth a prompt visit rather than assuming it's simply more of the ordinary kind. And here's something worth knowing honestly. Family members and friends very often notice a man's hearing decline well before he does himself, since the change is gradual and he's had time to unconsciously adapt around it. If someone close to you has gently mentioned the television seems awfully loud lately, that's worth taking seriously rather than brushing off, even if it doesn't feel that way from the inside. I want to add one honest connection here without repeating everything I covered in an earlier video on brain health, where we discussed how untreated hearing loss specifically ties into cognitive decline and social withdrawal. What I'll add today is the more immediate, everyday version of that same idea. Untreated vision or hearing loss doesn't just affect reading or conversation in isolation. It quietly shapes how much you engage with the people around you. A man who's struggling to follow a group conversation, or who can't quite make out who's approaching him across a room, tends to gradually pull back from exactly the situations that keep him socially engaged, not from any lack of desire to connect, but simply because it's become tiring or embarrassing to keep up. Addressing these isn't just about the reading or the hearing itself. It's often, quietly, about staying in the room with the people you care about. So, practically speaking, get the comprehensive dilated eye exam every 1 to 2 years we discussed, not just a casual vision check, since that's specifically what catches glaucoma and macular degeneration early. Get a hearing test if it's been years, or if anyone close to you has mentioned the television or your responses to conversation, and don't let any embarrassment about hearing aids stand in the way, since the modern versions bear little resemblance to old assumptions. Protect both proactively, too. Sunglasses that block UV light genuinely help your long-term eye health, and protecting your ears from consistently loud noise, whether that's machinery, concerts, or headphones turned up too high, slows unnecessary additional damage on top of the ordinary aging process. And know your family history for both, since glaucoma and macular degeneration in particular run in families, and that history should shift how proactively you're screened. One specific practical consequence worth naming honestly: both vision and hearing changes affect driving safety, and this is an area where it's genuinely worth being proactive rather than waiting for a problem to force the issue. Difficulty with night driving specifically, glare from oncoming headlights, or trouble judging distance can be an early, subtle sign worth mentioning at your next eye exam, and it's a completely reasonable thing to bring up directly rather than working around quietly on your own. Nobody wants to have that conversation, but having it early, on your own terms with your eye doctor, tends to go considerably better than having it forced later. And a few low-effort practical changes worth knowing, since they genuinely make daily life easier without requiring a diagnosis or a doctor's visit at all. Brighter lighting throughout your home, particularly on stairs and in hallways, meaningfully reduces both eye strain and fall risk for aging eyes that need more light than they used to. Reducing glare with proper lampshades and matte rather than glossy surfaces helps too. And if hearing in group settings is the main struggle, simply choosing a seat facing the people you're talking to, where you can see their faces and read lips somewhat without realizing it, or asking a restaurant for a quieter table, are small, easy accommodations that make a real difference without any equipment at all. If you've noticed changes in either your eyes or your ears and quietly filed them away as just getting older, I want to leave you with real reassurance. Most of what you're likely experiencing genuinely is the ordinary, well-understood kind of change, and it's remarkably well addressed by modern glasses, cataract surgery, or hearing aids, tools that let most men continue seeing and hearing the people and things they care about without much disruption at all. The goal here was never to alarm you about your eyes and ears. It was to make sure you know the specific, narrow list of things that deserve a prompt look, so you can relax about everything else and simply keep up with the regular exams that catch problems early. So here's what I'd like you to take from today. Presbyopia and gradual, symmetric hearing loss are the ordinary, expected shape of aging eyes and ears, and they're genuinely well handled by glasses and hearing aids. Sudden vision loss, severe eye pain with headache, or sudden hearing loss, especially in one ear, are the specific signs that deserve prompt attention rather than a wait-and-see approach. And the regular exams, both eyes and ears, matter precisely because a couple of these conditions progress quietly with no symptoms you'd notice yourself. Book both if it's been a while. It's a small task that protects a great deal. If this helps you sort out what's ordinary from what's worth a call, a like helps another man get the same clarity. Subscribing means you'll catch what else this channel covers. Here's my question for the comments. Has anyone close to you ever mentioned your hearing before you noticed it yourself? I have a feeling that's more common than most men would admit. Since we touched on the connection between hearing and staying engaged with people, my earlier video on keeping your brain sharp after 60 goes deeper into exactly why that link matters. You'll find it on the end screen shortly, and down in the description as well. Book that exam this month if it's overdue, and I'll see you in the next one.